The goal of this medical school is to try to admit a student body that looks like our community. I think this HEAT Award is a great reflection on this mission and our core values of the School of Medicine's deep and abiding commitment to diversity, equity, and inclusion.
So the HEAT Award is the only national recognition for colleges and universities around the country that really are dedicated to diversity and inclusion across their campuses.
So we designed our programs to address the leaky pipeline. We decided that we were going to pick pipeline programs that are schools-defined diversity categories. So for example, one of the programs I'm most proud of our black men in white coats. We know that less than 2% of practicing physicians are African American men. And so by having this program, we've had 40 young men from the Young Men Leadership Academy who we said to them this: if you can't see it, you can't be it.
As I look around, the people in this room, so many of you, all of you, are the champions for this effort. They're the people that are out front with the banner, and they're giving us instruction and help and encouragement, but they're not doing everything. That has to be done in math and science and English in the rec center. Then it becomes all through our campus.
You know, the underrepresented people in your campuses are the people who need that voice and need to be able to have role models and mentors and people like Dr. McBride to help them with not just the everyday, but it's their future, their careers as well. And so when you look at a lot of these programs, they're not just for today, they're for tomorrow and forever.
We're training the student for the future 20 years around health equity. One of the things that the National Institute of Health is saying is that more medical schools have to address health inequities and health disparities. And I believe that the School of Medicine is in the community saying that your zip code shouldn't dictate your health outcome.